How do you present treatment to a patient? I think it's the most anxiety-producing thing almost that dentists do. Is how do you know what to present? How do you know how much to present? And so what that seminar does is it starts with, who's your patient? Because guess what? Your patients aren't all the same. And so what we try and get students to recognize is that there's some patients, they basically look at you as an emergency room. I have a problem, I want you to fix it. When I have another problem, I'll see you later. Some patients want to make sure that they come in, they get their teeth cleaned, and they, get really good routine care. Other patients, they may want the best dentistry there is, they may want veneers, they may want, a whole makeover. And the trouble is you don't know who any of them are, because all they do is they call on your phone and ask for an appointment. So what we do in that course is we start by talking about how do you identify on the phone who that patient is? How do you communicate that? So you can align your behavior as a dentist with their expectations. Doesn't mean you won't try and grow their expectations later, but that way you're not under-examining and under-presenting to people who want more, and you're not over-examining and over-presenting to people that want less. And so that's the start of that seminar. Really important stuff to me. And basically for most general practices, what I tell them is there's probably 3 different ways that you should be bringing patients in. 3 different lengths, 3 different styles of new patient experience. And we talk about how to identify that and how to communicate that to the patient. And then we go through the process of what happens when we do get patients that have a lot more complex problems, but they think they only have one little problem. And how do you talk to them without scaring them away? How do you show them what's possible and grow them, or at least allow them the opportunity to grow? So a large part of that first part of that seminar is all of that. It's really the crux of the first morning, along with then ultimately, so what does it look like to talk to a patient and present a treatment plan, which is what most dentists think a case presentation is. But in truth, it starts before that. The rest of the seminar is really treatment planning. But we take an interesting twist on it, because what we recognize is there are simply financial limitations to what patients can do. So after going through the introduction of the morning on who your patients are and how we communicate with them, we move into a section on how can we stage treatment for patients so that we can make treatment more manageable economically. So essentially that's the course in a nutshell.